According to the World Health Organization, out-of-hospital cardiac arrest caused by a heart attack is the leading cause of death in the world. When a casualty experiences a heart attack, it is often caused by a narrowed artery in the heart, which does not allow adequate circulation to the heart muscle. If the narrowing is temporary, the pain or discomfort is called angina. It can be relieved with rest and medication, usually nitroglycerin. If the lack of circulation is profound, the heart muscle can die due to a lack of oxygen. The casualty suffering angina or a heart attack will show signs of shock. They look pale or with ashen skin, and there may be blue-tinged earlobes, lips, and fingertips because blood is being redirected to the vital organs. They feel cold and clammy as there is no blood in the skin and the sweat glands have relaxed. They may be breathing poorly, rapid, and shallow. They may show pain in the upper body, anywhere from the upper abdomen to the lower jaw and arms. The pain is not a sharp, stabbing pain, but a broad discomfort, or a crushing, squeezing sensation. They may complain of nausea or begin to vomit. They will be frightened and will often deny the seriousness of the situation and refuse help. If the casualty is in shock and in obvious pain, but insists they are all right, this is an important call to action. As soon as you recognize the signs and symptoms of angina heart attack, call or have a bystander call for medical help. Place the casualty at rest to reduce the work the heart has to do. Help the casualty choose the position that is most comfortable to them. In most cases, this will be a semi-sitting position. Make the casualty comfortable and reassure them to lessen fear and worry. Help the casualty take their prescribed medication if available. Nitroglycerin tablets or sprays are common medications for relief of angina pain. Ask the casualty if he uses drugs to treat erectile dysfunction, such as Viagra. If the person has taken any of these drugs, it is recommended they not take nitroglycerin, as this may cause a significant decrease in the person's blood pressure. Spray under the tongue or place the tablets under the tongue. They are not to be swallowed. Nitroglycerin may be repeated, if needed, every 5 to 10 minutes to relieve pain, or until a maximum of 3 doses have been taken. If the casualty has no prescribed medication, or there is no relief after the first dose of the prescribed medication, ask them if they have any allergies to ASA, or if a doctor has ever told them not to take ASA. If not, suggest they chew 1 regular ASA tablet or 2 low-dose ASA tablets and monitor until medical aid arrives. If too much heart muscle dies, the heart loses the ability to pump blood properly. The most common arrhythmia is when the lower half of the heart quivers uncontrollably, what is called ventricular fibrillation. At this point, the casualty loses consciousness and stops breathing effectively, or breathing becomes gasping and irregular, which is called agonal breathing. This is called cardiac arrest, and the first aider must begin CPR and use a defibrillator as soon as possible.